Hello, welcome. Thanks for coming. Thanks for taking the time out of your day to attend. And as usual, it's always a pleasure to do these webinars with the American Acupuncture Council. So thank you to American Acupuncture Council for having me back. So you might be able to tell that I'm kneeling here. And that is because pretty soon I want to be standing and showing some Qigong movement. Hopefully, if you're at a place that you can get up and do it along with me, that'd be great. So better to be a little bit interactive with it than just standing and watching or sitting and watching. So feel free to get up. I'll try to orient the instruction around the idea that you're going to be taking part with me. But I do have a few things to cover first, and we'll look at a couple things anatomy specific for the low back that'll give us a little bit of focus when we go into the movement. So let's go to the PowerPoint, and then we'll go ahead and start that. So the picture here, the image is from 8 pieces of brocade. We're going to be looking at 4 of the 8 movements of 8 pieces of brocade. Each of these movements really could be quite good for the low back, but I picked 4 that are representative of certain concepts that I want to show. Maybe we'll get to 4 of those. Maybe we'll just get to 3 of them. We'll see how time goes. But I'd like to get to all 4 of these. So let's look at a couple things anatomy-wise first. So what we're going to focus on with the low back, it's a pretty comprehensive, pretty big region, lots of structures. I want to focus on a particular part of the thoracolumbar fascia. So thoracolumbar fascia, if you look at anatomy illustrations, that's that diamond-shaped structure that sits kind of in the low back, usually illustrated in white, which is a fascial structure. If you're doing dissection, it all kind of looks the same. But for illustrations, they kind of really highlight that kind of diamond-shaped thoracolumbar fascia, which looks like a sheet. Thoracolumbar fascia is an aponeurosis, which means it's a wide, flat tendon. But those illustrations don't quite highlight the multi-dimension, multi-layered quality of the thoracolumbar fascia. We want to zoom into a particular part of the thoracolumbar fascia called the lateral raphe. So let's look at that structure on this illustration. I have my pointer here. So I want to highlight this portion of the thoracolumbar fascia that sits over on top, superficial, maybe I could say posterior, to the erector spinae. So here's the erector spinae muscle group, part of the urinary bladder channel, as we start talking about the channels. So that layer of the thoracolumbar fascia is what you'd see in the illustrations. That diamond-shaped structure is what sits over the erector spinae. But there's another component of it that goes deep to the erector spinae between it and the quadratus lumborum. So there's names to all this. We don't have to get too hung up on that. That's the posterior lumbar fascia that sits on top of the erector spinae. It's the middle lumbar fascia that sits between the erector spinae and the quadratus lumborum. There's another layer that goes in front of, anterior to the quadratus lumborum. Some models talk about 3 layers of that thoracolumbar fascia. I think most of the direction it's going now is that more anterior layer is considered a different fascial layer. It's different embryologically. So I kind of like this 2-layer model of the one that's superficial to the erector spinae and between the erector spinae and the quadratus lumborum, very deeply integrated with both of those muscles. So the lateral raphe is that seam, that meeting point where those 2 layers come together. Or I guess if you're in a 3-layer model where those 3 layers come together, but we'll stay with the 2-layer model. So there's the lateral raphe. It's at that lateral edge of the quadratus lumborum in the erector spinae, deeply integrated with both of those muscles. If we follow that fascial structure going more around the body, that links up with the abdominal layers, especially the internal obliques and the transverse abdominis, wraps around to the front, forms another seam where those fascial layers come together. This is referred to as a semilunar line, just lateral to the rectus abdominis, part of the stomach sinew channel. So rectus abdominis, deeply integrated with the lateral raphe and deeply integrated with these 2 structures that are part and linked with the lateral raphe, urinary bladder sinew channel, the quadratus lumborum, part of the liver and kidney sinew channel. So a lot of channels going on. We'll come back to that and look at it. But I just want you to have an appreciation at this moment for how this lateral raphe communicates with a whole ton of structures in the low back. Sort of a pivotal point. It's like a lever that everything attaches to and kind of communicates through and helps coordinate movement, helps the body know when the quadratus lumborum contracts. The rectus abdominis knows that, and it can link its contraction, link its activity with it. So all of those structures can work together through the lateral raphe, through the mechanical pull of the lateral raphe. So we're going to look at movement to highlight that. But let's look at a quick video that'll show some palpation, some acupuncture ideas, some manual therapy ideas. So for those acupuncturists who are wanting to link maybe some prescriptive exercises for their patients with their acupuncture and manual therapy treatments, this will help with that. So we'll go over, look at a video, and then we'll come back and start doing some movement. Palpation of the low back can be complex. One of the key unifying structures to consider with palpation is the thoracolumbar fascia, especially a region within it where the abdominal fascia wraps around and joins with the lateral raphe. The lateral raphe is a fascial seam at the lateral edge of the erector spinae and the quadratus lumborum. From here, the fascia splits and goes superficial to the erector spinae, and the other layer goes between the erector spinae and the quadratus lumborum. It's a pivotal part of the fascial system of the low back, as it moderates forces such as side bending, rotation, and flexion and extension. Start by finding the lateral edge of the iliocostalis lumborum. This will be your window into the lateral raphe. Press on the lateral edge of the iliocostalis lumborum towards the quadratus lumborum. From here, I can palpate more superficially towards the erector spinae, or change my angle and press towards the quadratus lumborum. I'm looking for areas of maximum tension. I can press towards the 12th rib, or press down towards the iliac attachment. Again, looking for regions of maximum tension. At the lateral raphe, I can mobilize by lifting and decompressing, or I can press and derotate the tissue. I can also apply a shearing force either up or down. For acupuncture, I need to transition from my palpating hand to my needling hand. I need to press and find the region of maximum tension, assess the angle, put the needle in that exact angle, and then advance the needle to the depth that I was palpating. I can use a lifting and thrusting technique until I find the region right there where there is a fasciculation. You can also palpate fascial structures in the front of the body as they relate to the low back. The fascia from the abdomen wraps around to connect with the lateral raphe in the back, but it also continues as it wraps around to the front to the semilunar line, and then a portion of that fascia wraps over the rectus abdominis, and another portion of the fascia dives deep to the rectus abdominis. From the semilunar line, I can press into the rectus abdominis and feel for taut bands within this muscle. I can move slightly up, palpating across the bands of the rectus abdominis, looking for areas of maximum tension. I'm also looking for regions that might refer back into the low back. From the semilunar line, I can press into the rectus abdominis, feeling for depth, transition from palpation to the needle, and then advance the needle in the same angle to the depth that I palpated, and there was a fasciculation. Due to its strong fascial connection, reducing tension at the rectus abdominis will translate to reduced tension in the back since the fascia wraps around and unites at the lateral raphe. All right, so let's look at some movement for that. We're going to be looking at, like I said, 4 movements from 8 pieces of brocade. Maybe we'll run out of time and just do 3 movements. There's 3 main ones I want to cover, but we might get to a 4th one. But I want you to have this idea that we're working with the channels when we're doing particular movements. When we're doing more expansive movements, where the body's opening, lifting, and stabilizing in the core, we're primarily using the Tai Yang and Xiao Yin channels. I guess for low back, would be primarily looking at urinary bladder and kidney sinew channel. But for this first movement, we'll also be using small intestine and heart sinew channel, especially small intestine sinew channel. So we're using whole body exercises to really zero into this area of the lateral raphe and improve back health. We also want to do some compressive forces using a lot of the abdominal movement. So Yang Ming Tai Yin channels, specifically for low back, we'll be thinking about the stomach and spleen sinew channels. And then the Xiaoyang Jueyin channels are going to have much more to do with rotation and with side bending movements. So we have some expansive aspects, some compressive aspects, some rotational movements, and some side bending movements, all to be able to work, pull on the fascia, pull on various muscular structures, to pull on the fascia of the lateral raphe and improve that communicating and supporting nature of that structure. So these are something that I work quite a bit with in Zoom class. I teach 8 pieces of brocade and some other Qigong and strengthening type exercises. So if it's something you're interested in, feel free to get in contact with me about that. We'll be covering at least a good portion of those movements here. So last thing, and then we'll go to movement, is I do have a series of online classes that I teach with Matt Callison as part of the sports medicine acupuncture certification, but also just the some smaller classes on actually the quadratus lumborum, which covers a lot of this information that we're talking about in the lateral raphe. We also have a class on the psoas. Both of those are kind of linked and will be some crossover information from what we're covering today. Not as much the Qigong movements, but some of the anatomy and the acupuncture manual therapy ideas. So I think I'm done with the PowerPoint. I'm going to move it. We'll go and get set up for some movement. Give me just a second. And there we go. All right. So I'm going to back up, get into position. So we're going to start with, let's start with a movement. It's actually the second move in 8 pieces of brocade, and it is called draw bow and shoot hawk. It's going to highlight much more of this opening, expanding aspect where we're stabilizing and getting a lot of core strength. This movement in 8 pieces of brocade actually specifically is discussed as working with the kidneys. So we want to get a lot of movement in the low back so that the kidneys can roll and move along the psoas, which is what they do. But it's also going to start opening and kind of expanding that lateral raphe on both sides. So we're going to start this movement in a wider stance, horse stance. There's going to be a lot of aspects of compression to give us full range of movement so we can come out of that compression and expand. So just to give you a quick summary of that, or maybe you can try this with me. You can put a hand on the lower rib cage, another hand on the lower dantian, just below the belly button. And I want to have this sense that those two come together, which means I need to tuck my pelvis under a little bit and bring my rib cage down so that there's a compression. If I were to look at that from the side, I'm not leaning forward, I'm compressing. So that's position 1. Then as I come out of that and start to expand, I want to lift the chest, neutralize the position of the pelvis. As I'm opening and as I start opening the hands, which we'll look at in a second, there's going to be a tendency for the pelvis to go into an anterior tilt. So I have to support with my kidney sinew channel, part of the core structures of the body, to keep the pelvis neutral, keep the expansion, keep the decompression of the spine. So position 2, we'll look at it with the arms in a second, but it's expanded. So we're going from a compressive position to an expanded position. So primarily using the urinary bladder and the kidney channels to expand. So I'm going to come back to facing the camera. Hands are down. I'm going to compress. Hands are going to come up the midline. One hand towards the opposite shoulder, almost like a boxing position. Then I want to open like I'm drawing a bow open. Pull the chest open. Chest faces forward. Elbow of the straightening arm faces down, so I have to externally rotate. Broaden the chest, straighten the body. Hands come in, compress. And back up. Go to the other side, compress. Hands come up the midline. Hand to the opposite shoulder. I'm drawing a bow open. I have to expand, lift the chest, turn the elbow down towards the floor, open the chest, straighten the body. Hands in and back up. Again, we'll go a little faster this time. Hands up the center line of the body. Opposite shoulder. Straighten the body. Pull the chest open. Drop the elbow. Broaden the chest. Everything straight. Hands in. And back to neutral. So the diaphragm actually attaches to the lateral raphe, or at least it has fascial communication. So let's see if we can put breathing into it. So I'm going to start here neutral. Inhale. Hand to the opposite shoulder. Exhale, pull open. Elbow faces down. Inhale, hands come in. Exhale, expand. Inhale. Exhale helps you create force. Open, expand, lift, chest open. Inhale, everything comes together. Exhale. All right, quick thought about the breathing, and then we'll move on to another move. So you might find the opposite of what I said. So breathing, I don't get too hung up on. I know it's talked about a lot in Qigong. It's definitely important for low back health because things like the quadratus lumborum, lateral raphe are deeply integrated with the diaphragm. Interestingly enough, in some places you can get your 12th rib removed, completely cosmetic, creates a streamlined waist. Some people go, I think you can get it done in Mexico, and not recommending it. But the idea when you do that is they cut the rib at the spine, tease the fibers away, and pull the rib out. And what you're left with is that seamless continuation of the quadratus lumborum and the diaphragm. They don't have to cut the diaphragm and cut the QL and sew them back together. They're already together. You just have to tease the fibers away from the bone, bring the rib out. I'm not recommending it, but I want you to understand that to have an idea of how integrated those structures are. So breathing's important, but breathing's also really tied into our core. So if we don't have the tone in the transverse abdominis, maybe it feels odd to have that inhale when I'm compressing and that exhale as I'm expanding. So maybe you have the opposite, no problem. The idea that you're linking the breathing to the movement's good. Over time, you might find that it changes and you can have it more like I'm telling you in this particular demonstration, but the breathing can be flexible. So you want it to feel natural. All right, so draw bow and shoot hawk. We have that opening, expansion, everything's lifted, elbows down, so we're engaging at the shoulder, but we have a lot of movement in the low back to be able to work with the low back pain patients. Let's look at another move. This is the 6th move in 8 pieces of Brocade. It's called turn head and sway tail. This one will have a lot of rotation in it. One of the key movements that we will have for a lot of people with low back pain, sacroiliac joint pain, just multiple types of low back pain, facets, trigger points in the quadratus lumborum, trigger points in the erector spinae, etc. It's going to involve much more of our liver sinew channel and our gallbladder sinew channel. So those rotational aspects are very pivotal for a lot of low back movement. I'm going to keep this horse stance. you might find a little narrower works for you. I need to bring myself down, hands on the knees. If that's challenging for you, you can be up a little higher, but I'm going to be down at the knees. My fingers are on the inside of the thigh, thumbs on the outside of the thigh. I can spend a moment to get the back comfortable. I have that hollow body, curved back. I'm not leaning forward. So my whole, from the pelvis up to the spine's curved. Okay. First thing is I want to turn my whole body, hips, low back, up through the chest, shoulder girdle. So turn, lift the chest. Imagine I have a little beam that I have to get under here, and I have to roll under that beam, compress, turn, lift the chest up. Under that beam, I have to let the spine curve, duck under, lift, chest up. Common mistake is I'm just turning my shoulders and cranking the neck around. I want to turn at the hips. If I'm doing it correctly, I should feel one knee slide forward just a little bit. As this hip opens up, this other knee pulls back. I keep the structure. I'm not collapsing, but there's movement sort of in the legs as one turns. That's going to transfer to a turn in the legs. So we'll go back down. We'll do it again. Keep that in mind. You want to turn the hips, turn the spine, turn the torso and rib cage, turn the shoulders. So it's equal turn coming all the way up the body. If you do it properly, you should even feel it in the feet. You should feel that rotation drop into one arch, lift the other arch. And then as you go the other way, it changes. So again, we're going to come down. Spine's curved. I have a hollow body. I can kind of warm up, get comfortable in that position. Fingers on the inside of the thighs, thumbs on the outside. Something I need to get under, like a beam or something, so I can duck under that. Turn from the hips, turn from the low spine. Lift the chest, rise. Part of me stays down, another part of me comes up. Underneath, turn, lift. Underneath, turn, lift. Under, turn, lift. So this one in 8 Pieces of Brocade, they actually talk about working on the lungs, which it does also if you look at the upper body. You can talk about that another time. But I'm thinking of that rotation and how that's integrating with the low back. All right, so turn head and sway tail. Challenge of that one is leg strength. You have to work on it to where you're comfortable in that position. But really, really an excellent move for low back problems. Next one, let's look at, this is actually the first move of 8 Pieces of Brocade. This is called Two Hands Lift the Heavens. We're not in a horse stance. We're going to be shoulder width stance. Hands are going to be overhead, so I'll be reaching up. So it'll give you an idea of where I'm going with that. Not much happens with the lower body. I can start with my hands out. This one works with the Sanjiao organ. So we're looking at triple burner, Sanjiao, but it also works quite a bit with the gallbladder sinew channel, as you'll see. So hands curve up. My whole spine is slightly hollow. Point the hands towards the ceiling. Lift the chest. Optional is I can come up on my toes. Fully stretch. Up. Hold for a second. There we go. And then back down. turn to the side or bend to the side. My chest faces forward. So definitely stretching the lateral raphe on the side that I'm bending away from. Back up. Now I'll compress the lateral raphe on that same side that it was stretching a second ago. Obviously stretching on the other side. Back up. Chest relaxes. Spine bows. Chest rises. Okay, do it a few times, but let's look at where people tend to get a little off on this move. Sometimes if they don't have the flexibility to pull the chest back, to pull the shoulder blades back in particular, I should say, then when they go to rotate, they turn. So they turn what should be a side bend into flexion. Right, different move. I want to keep the chest facing forward in side bend. If I need to compromise the straight arm position, no problem. I can have my arms down. That might help me keep my arms open, my shoulder blades together. But I want to get up as high as I can comfortably without distorting the move. So you want nice, clean side bend, stretch, 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 stretch. So it's like fabric being pulled. The minute you start going into flexion, then you lose that. Okay, so hands down. Exhale. Inhale, chest lifts. Keep the chest lifting. Exhale, fully stretch. You don't have to straighten the arms. That'll be individual. Then down. Exhale, side bend. Inhale, back to the center. Exhale, side bend. Inhale, back to the center. Chest relaxes. And up. One more time. Inhale, compress, everything slightly curved. My hands are going up only because my chest is going up. Chest is rising. Chest is rising. Exhale, up on the toes. If you don't have the balance for that, no problem. You can skip that part. Inhale, back to the center. Chest open, neck relaxed. Exhale, side bend, stretching all the way through the hip to the feet. Inhale to the center. And exhale. Back up. All right, so we had draw bow and shoot hawk, working a lot with the tissues, a lot of movement in the low back to work on the structures we're talking about, but there's also mobilization of the kidneys as we bend forward, straighten up. Those kidneys are able to rise and fall, and we get a nice little massage on the kidneys. Very important for back health. We had that turning one, turn head, sway tail, a lot of movement in our liver. also really deeply integrated with the low back, lateral raphe, quadratus lumborum. So there's a lot of rolling and moving of the liver. I guess we could say the other side, also the spleen. Not sure with webinars, sometimes you get a mirror image. So this is my left side spleen. This is my right side. I'm not sure if it's playing that way on your screen. So a lot of movement, mobilization of the liver. Side bending, we also get a lot of mobilization of the liver and spleen because the liver is able to rise up. The liver is able to come down. So lots of movements with structures that are deeply integrated with the low back. This next one really works a lot with the stomach. So this is separate heaven and earth. One hand down. One hand points up. My wrists are on the midline. I can only get up so far where my chest is up before I need to change. And I can change just by letting the hand turn towards the opposite side. This hand pushes down. This one turns a little bit. And back down. Chest bows slightly, spine curves, chest opens as my hands pass. Exhale, stretch. Inhale together. Exhale, open and stretch. Inhale. And exhale. Okay, we'll do a couple more times, but I want to show something. So it's like a washing machine for the stomach. As one hand moves, I get this little kind of movement through the center to help mobilize and turn the stomach, integrated with the abdominals, integrated with the low back. So as the hand lifts a little bit more, that's going to pull the rib cage up. As the hand pushes down, that's going to push the rib cage down. So I get a little bit of side bend, but I'm not side bending, so to speak. It just pulls me into a little bit of a position of slight expansion on one side, closing on the other side. Then neutral. So don't side bend, but just let the rib cage move. So as I get farther up and I continue to stretch, I get that little bit of expansion on one side, a little bit of compression on the other side, and I'm able to move the lower rib cage, move the stomach, move the 12th rib, move the lateral raphe. Expands on one side, compresses on that same side as it starts to expand on the other side. Okay, one more time each side, chest bows, chest opens. Chest bows, chest opens. Chest bows, chest opens. All right, very nice. So all four of those exercises move the low back in a different way. None of them are extraordinarily stretchy. And, we stretch pretty decently on that two hands lift the heaven, the side bending, but they're mostly just moving. It's like a stretch, compress, stretch, compress, engaging structures, relaxing structures, engaging structures, relaxing structures. Those are the types of things that really help create a gentle mobilization of the low back in a way that really improves the flexibility, elasticity, and ability to stabilize for the fascial system, especially things like the lateral raphe that are so integrated with the front of the body, with the back of the body, with the core of the body, with the rib cage, and with the pelvis. So it's kind of a lever in some ways that helps integrate movement between all of those structures. And we want to be able to take it into flexion, extension, side bending, rotation. So each of those offers a window into one of those particular movements so we can be holistic in our movement of the low back and improving health of the low back. All right, I think we're good. Good timing. So 4 more moves, maybe another time. But also, like I said, I have some Zoom classes. You're welcome to come into those if you're interested. Just shoot me a message. But those 4 movements I thought were really key for low back health. Simple to apply, easy to give to patients. I work with them quite a bit. I use them myself. They're great exercises. So thanks again to the American Acupuncture Council. And maybe another time we'll cover the next 4 moves.